Welcome back to Afternoon Live. If you've noticed thinning hair, you're not alone. More than 80% of men and nearly 50% of women will experience significant hair loss in their lifetime. So here to tell us why and what we can do about it is plastic surgeon Dr. Stong is with us today. Dr. Ben, thanks for being here.
Thanks for having me.
So we're talking about quite a few people that experience hair loss in their lifetime. What are the main reasons for it?
The most common reason for hair loss in both men and women is what's called androgenic alopecia. It is a genetic sensitivity to a byproduct of testosterone breakdown called DHT, and that causes your hair follicles to go through a miniaturization process where it becomes thinner, finer, wimpier, eventually falls out. And if that hair follicle is left exposed long enough to the DHT, it kills the hair follicle and you have permanent hair loss.
What is the average amount of hair that people lose, healthy hair that people lose in even a day or a week?
About 100 a day, roughly. And it's a balance, right? So 100 fall out and then an roughly equal amount start to regrow, and that's why you don't see a loss of density over time.
So when you're seeing more than that 100 or whatever it might be fall out, then you know that you're experiencing a problem. Is there much that people can do about it?
Oh, absolutely. There's several non-surgical interventions. First and foremost are the topicals like minoxidil, 4% over the counter. Finasteride or Propecia is an oral pill. It's probably the #1 best thing you can do, particularly at a young age or early onset, to preserve your hair and get whatever regrowth you're going to get. And then as if those things don't work, you can also add platelet-rich plasma with A-cell we use quite frequently. We recommend about 4 treatments over a 1-year period. And then whatever result you get from that, you either go on to maintenance treatments with those injections, or then you start looking at things like hair transplant.
So when you see like the biotin and the hair, skin, nail, I mean, there's so much out there that you can kind of get overabsorbed with all these different products. Do those not work, the biotin type ones?
Marginally. Of course, if you tune yourself up both from a diet perspective, a vitamin perspective, those are healthy things you can do for your hair. But hair loss, genetic hair loss in and of itself is not going to be altered that much by those types of things. The same with even the DHT blocking shampoos. Oh,
no, the shampoos do or do not, you would say?
They don't work all that well.
Okay. So what was that one that you said for sure is the early, what was the name of it?
Finasteride or Propecia.
Okay, are the ones to look for. And altogether, to prevent it, is there anything you can do?
Not androgenic alopecia. You either are going to get it because your ancestors gave it to you, or you got lucky and didn't get it.
Okay, but what about hair loss in general when it comes to hormonal?
Yeah, hormonal, absolutely. I mean, it's typically not permanent from a postpartum perspective or menopausal perspective. You can get on hormone replacement therapy, or from postpartum, it will work its way out over time.
And then as far as like you hear, don't wear a hat, right, for men, and that's going to cause baldness, or for women, or don't wear your hair in too tight of ponytails. Is all that true?
Hat is not true. Tight braids can result in what's called traction alopecia, where your hair basically your hairline starts going backwards with the tight braids. So you want to wear loose hairstyles in general. Again, that shouldn't be permanent either, and gets reversed with those platelet-rich plasma injections over time.
And then what about like the silk pillowcases? Because like people talk about losing their hair overnight. Do those actually work?
No, that's more of an urban myth in general.
Okay. And then like the transplant, like the hair transplants, what works out of those?
Excuse me?
As far as the hair, like the transplants or however that works, isn't there like all different ones that you can get?
Yeah, so the main one, the one we use is called FUE, follicular unit extraction, and we shave the back of the head. We take the individual hair follicles out of the back of the head, and then you move them where you need hair. They turn into little scabs, they flake off, and then eventually you just go back to what you look like right before the transplant, but they start growing about 4 months post-transplant, and then more and more and more turn on until you reach your final result about 18 months post-transplant. It works beautifully, it looks completely natural, and nobody will know you had anything done.
Wow, and so is that what we were just looking at right there? Someone who had done that?
Yeah, that was one of them.
And do you do the same for males and for females?
Yep, it's both FUE for both. Well, in females, there's a certain reason to use strip method, but it's very rare.
Such good information. Is there any other vitamins, supplements, or anything else that can help?
No, I mean, I think just as long as you maintain your healthy diet, there's two sort of pills over the counter that are very popular right now. Viviscal Professional is one, Nutrafol is another.
Such good information, Dr. Ben. Thank you so much.
Thanks for having me.
Yeah, we'll have more information on our website as well at katu.com.